Welcome to Suzanne's studio. I'm Suzanne Barnett, your host, and tonight I am so pleased and honored to present my guest, Dr. Stan Fischman. Dr. Stan Fischman is a board-certified, world-class psychiatrist. He practices at El Camino Hospital in Mountain View, California, and he teaches at Stanford University, and he does all kinds of fabulous things with children and adolescents. Is that right?
That's correct.
I know. I heard that, and I'm so happy to have you on the show. You have a reputation that is wonderful, really. It's true.
Thank you very much.
Yeah. So, you specialize with children and adolescents, and we're going to talk about, there's so much to talk about, right, Stan?
Absolutely.
But eating disorders, let's start with that.
Eating disorders
Yes.
are very, very serious. It's probably got the highest mortality of all the psychiatric illnesses. And most people don't realize that. And the mortality is, as I mentioned, very, very severe. And the reason, there's a lot of debate as to what causes it. I have a very different theory from the popular one, and it seems to work very, very well. And that is that this is not a psychiatric illness. That it's actually because we live in a society where thinness is praised and sought, particularly by women. Not only by women, but particularly by women, young women, who are going through their teens, when their bodies are changing like crazy, when their appetites are increasing like crazy because the body needs energy to grow, and they go on diets. And one of the worst things that a young person can do is to go on a diet because their body thinks that they're in the middle of a famine. Once their body recognizes or believes that they're in the middle of a famine, it does things to protect us. Because you and I are here today, and all the other people in this world, other 7 billion or so people, because our ancestors survived long enough to have children. If they didn't, or they couldn't raise the children because of a lack of food, which is very, very common throughout history, we live in a very unusual world where we have a Safeway on almost every corner, a Safeway type place on almost every corner. We can go out to eat anytime we want. We could get up in the middle of the night and go to our refrigerators, which our ancestors didn't have. We can go to our pantries. We can go to, or we can even go out to a restaurant that's open all night. It's very common throughout the world that this is our world, that this is true. So we begin to get symptoms of a famine when we're dieting. And our body starts doing things to protect us, like making us hungry, you know, even though they don't want to be hungry, making us, if we've not eaten for a while or very much for a while, we'll maybe binge. All one has to do is think about the fact that if you miss lunch some days, if you're used to eating lunch and you miss lunch, you come home, you just want to eat anything that you can get your hands on. Well, this scares the person with the eating disorder because I'll say she here, because that's the vast majority, about 90% are female. She will just crave these things, and particularly crave sweets, which scares her even more. Because why do we crave sweets? We crave sweets because they give us quick energy. And that keeps us going long enough till we can get to a place where the famine would end. The Bible, for example, is loaded with famine stories, and it alters the entire history because of that situation. Because you know, people get up and they go across the Sinai Desert. I don't know if in the Old Testament they went across the Sinai Desert, and I don't know how many people have been there. I've been there, and I'll tell you, it is barren. B-A-R-R-E-N. And it's amazing. People in the Bible stories, they went across that with their camels and their children and stuff like that. so they could make it to the other side of this huge, desolate area. So the body is really geared to trying to rescue us. And the things it does make somebody who wants to be very thin very scared. So the real key is to find out with a patient what's the symptoms she has that make her feel fat, and teach her what she needs to eat to get healthy.
And do they go along with that?
Most of my patients do. When they see that I understand what they're feeling, they actually go along with it. Some people, particularly people who have been through many, many treatment programs before they've come to see me, they're sort of cynical about what I'm saying because it didn't work before, whatever they were doing. And now when they understand it, and the most fascinating thing is after about 6 months of eating healthy, good foods, no sweets, we can have occasional sweets, but not very many sweets, the patients actually don't even remember that they've had an eating disorder.
Is that right?
Yeah.
It's amazing.
It's amazing. And as long as they stay eating healthily, they continue to do well.
May I just ask you a question? Are people, for example, anorexics, can they really be cured 100%?
As long as they continue to eat well the rest of their life, because by going through this intense famine, their body is much more keen to take care of you as fast as possible. So they have to continue to eat pretty well the rest of their lives.
And of course, now this would be a perfect time for you to tell a dramatic story.
Well, I took care of a woman not too long ago who was 34 years old, had been sick since she was 14, so 20 years of severe anorexia, which eventually, as frequently happens, evolved into bulimia. And when I first met her, she was throwing up, binging and throwing up 27 times a day on average.
My God.
And when she had been pregnant a few years before, she weighed over 200 pounds, which is not unusual because the body is trying to protect her even more so, and the baby, because the baby has to be fed from her body during those first 9 months. And then, of course, if breastfeeding occurs, it needs the food then, and it particularly needs fat. Because most people don't realize it, but breast milk, as is cow's milk, is about 30% fat. You know, we don't get that when we go to the store because they've taken a lot of the fat off to make cheeses and butter and stuff like that. Isn't that interesting? Well, we got together. She had been in and out of many, many treatment centers, and for some reason I got through to her somehow or other, and she has totally redesigned her life. She is working very, very well. She moved back to a family which was in Chicago, which is in Chicago, and she has continued to just do beautifully. In fact, I got a letter from her the other day, in fact, that said what she was doing and catching me up on things. And when I called her up, I said to her, Kathy, how's the eating disorder going? She said, what eating disorder? I mean, I stunned her. She said, yeah, I had an eating disorder, didn't I?
Wow.
This has been about 3-4 years now. Isn't that impressive?
That's a wonderful story.
And she's gone on with her life, her children and everything, and she's a very, very happy woman.
But you deal mostly with young children and
that's
adolescents.
Right. Mm-hmm.
Boy, that's a challenge.
Mm-hmm. They're easier in that regard because they've not been sick that long and they haven't adopted the mentality of the self-identity of being sick.
Yeah.
And being anorexic, skinny.
And everything is about food today.
Everything is
not
about
just eating disorders, but just disorders with, you know, you
Health.
watch TV, and, you know, now we're not supposed to eat any sugar. Is that true?
Well, they're telling us that.
Yeah.
I don't know how many people can do that. I don't eat sugar.
You don't eat sugar?
No, I don't eat sugar.
I was going to ask you, you have to be a good example.
Absolutely.
Have you ever been fat?
Oh, yeah.
Really?
A long time ago. And then I woke up one day, it was a funny story, but I woke up one day and I found that my sister called me. and she is younger than me and was very heavy. And she told me, I've got the family disease because both my parents had diabetes, my grandparents on both sides had diabetes, and she says, I've got the family disease. And they were all type 2 diabetes. So I said, oh my God, and I went to see my regular physician, and he said, oh, we'll put you on an 1,800 calorie diet and stuff like that, and you can eat sweets and stuff along that kind of line. Just don't eat more than 1,800 calories. But it's not the calories that count. It's the quality of the calories. So
not the quantity?
Quantity plays some role,
yeah,
but not as importantly as the quality. What are you eating? Are you eating proteins? Are you eating healthy fats? Are you eating healthy complex carbohydrates? Or are you eating lots of sweets or muffins or ding-dongs?
Mm-hmm.
You know? That makes all the difference in the world.
What about how young are the children that you treat? I mean, I know there
For
are all
eating
ages
disorders
that have this eating disorder.
Oh, they usually start in their late, in their junior high school ages.
Okay.
And there's a lot of pressure on them, and their bodies are changing dramatically.
Yeah, and isn't it true that people that diet, on these really strict diets, when they go off, they gain the weight back and then some.
And then some,
Yeah.
exactly right.
Yeah, that's so.
And it's amazing.
But
And then they
people
go
don't
back on
know
the
that.
diet to,
Yeah.
2 years later,
Yeah.
they've gained maybe 10% more than they had when they started.
Yeah.
Their weight than when they started. And they work very, very hard at losing the weight by dieting. And I've had a number of parents who are into that pattern of patients, and I say, look, eat like I'm telling your daughter to eat, and they lose weight.
We have to tell the audience that diets just don't work.
Diets
right?
make you fat.
Diets make you fat.
Mm-hmm.
Isn't that ironic?
And it's the body trying to protect us. I see
The
it.
famine thing.
The famine idea.
You mentioned something about genetics
Oh, yes.
and cancer.
Uh-huh.
Would you talk about that a bit?
In psychiatry or in
Yeah.
eating disorders?
In both.
Okay. In psychiatry,
Yeah.
the genetics, the world in psychiatry is changing so dramatically, as it is in medicine. I'm willing to predict that 10 to 15 years from now, you'll go to your doctor, your regular doctor, and the first thing he or she will do will be to get a genetic readout on you. Well, not the first thing, but one he's trying to figure, he or she is trying to figure out what's going on. That's what he will or she will do. And we are learning so much more about disease and genetics and rare disease as well as common diseases. It's absolutely fascinating.
In other words, are you learning that if a person has cancer in the family, that it repeats, or I mean, I don't know anything about it.
Well, there's certain cancers we know will repeat in families.
Like what?
Like, breast cancer. And there are a number of different kinds of breast cancers. And today, now this is a really fascinating thing. Today, we can get the genetics on that person both by history and or by testing. And if they have certain kinds, we treat them differently than the others. They also predict the odds of increased breast cancer and other cancers in their relatives or their because of that, and their progeny in the future. The second thing we do today is we can take the cancer out of the person, out of their breast or wherever, and we can send it off, and particularly for breast we're doing this. They will test to see what genetic makeup is in this thing, and they can prescribe the treatment much, much more carefully. Not one size fits all, like it had been for years. You got diagnosed with breast cancer, you got treated the same way that everybody else got treated. Pretty much, I mean, with variations, but minor variations. There are some people that that chemical treatments don't work for. And we can predict that now with a high degree of success. It's a tremendous change. And we're just at the beginning.
Do you think that cancer will ever be eradicated?
Absolutely.
Do you completely?
Well, I can't say completely,
yeah, but I mean,
but I think to a large degree it will be, yes.
How? How would that happen?
Well, by predictability, by getting early genetic tests on young people. So, for example, there's a gene called the BRCA gene, BRACA, that's how it's abbreviated. And that if we find that BRCA gene in somebody, we'll have them come in regularly for breast evaluations. They're told, don't wait till you're 40, do it earlier. Because we know that there's a great the odds are great that they're going to develop cancer later on, or ovarian cancer, which seems to come together with the breast cancer sometimes, that is, in families.
And how does that relate to psychiatry?
Well, psychiatry is a very complex genetic makeup. There seem to be, for most people who have serious psychiatric illnesses, such as schizophrenia, such as psychosis of any kind, such as severe depression, it appears at the moment that there may be 5 to 8 genes that may be critical. Now, I'm just speaking with limited knowledge at this point, but we're finding out, and they seem to be critical in the development of these and working together, so that if you just have one of those genes, it may not cause any problems for you. If you have all 7 or 8, it may cause big-time problems, if that makes sense to you. And so many of our diagnostic categories will probably have to disappear after we come up with what all these genes are and how they work.
Say you test a person that is a sociopath, for example. Is there ever any kind of cure for a sociopath?
I do not know about that in genetics.
Yeah, in genetics. I think it is genetics, though.
Well, it might be.
I mean, it could be.
It could be.
But, okay, say a person is really screwed up. Mm-hmm. He's schizophrenic or she's schizophrenic, bipolar, border personality and all that. How would you treat that person?
Well, obviously, you have to come to the best diagnosis you can come to.
Yeah.
But at this current understanding right now,
yeah,
there's a strong genetic relationship. You very frequently will find in families strong histories of depression or anxiety disorders, which are related. You may find a large number of people with bipolar disease and depression and stuff like that. But what I do is that if I try a patient on a medication, and if they respond, that's wonderful. But many, many patients genetically don't handle certain medications well, and others handle others not well.
Oh, my goodness.
And this is all genetically determined. And today, Suzanne, this is really the truth.
Yeah.
I can have a patient come in, I do this regularly now, and they've had some failures with medication. I take a swab, typical Q-tip that's sterilized, I rub it in their mouth, I put it in a package, I send it off by one of the FedEx type places or UPS, and it ends up in 4 days to 5 days later, I get back a report that tells me which medications that patient will likely respond to well, and which I should really avoid.
Is that right?
It's absolutely unbelievable.
Oh, that is really wonderful.
And it's been
to hear.
virtually 100%. So I've sent in about 60 of these now, and I'd say it's been almost 100% correct.
I have not heard of every GP internist. Psychiatrists should be doing that.
We will be doing it, I think, in years to come. But right now
why
it's
aren't
due.
they doing it now?
Because people are slow to change sometimes, and they don't ask. They want to be perfectly sure they're doing the right thing.
Boy, that is really science fiction.
It's like science fiction.
Isn't it? I want to tell the audience, too, that you've been practicing psychiatry for 55 years.
Correct.
Do you ever get burned out?
No.
Why not?
I love what I do. My wife will tell you I don't want to retire. I have no desire to retire. because I have too good a time doing it. It's hard work. It's not easy work, but it's very satisfying. And the more I learn, the more I understand, the more happy I am.
What if you have a patient that really doesn't respond to you? How do you deal with that?
Well, I'll often say maybe they're seeing the wrong psychiatrist.
Really?
Maybe I just don't understand them. And maybe they need to see somebody else. I don't get angry at them or anything like that because I just don't want them to be wasting their lives and their money and their time seeing me when they might respond better, and I try to find somebody I think might be better for them.
In your practice, do you use a lot of medications?
A good deal, yeah.
Yeah.
But there are other things besides that we can use that are very helpful.
Like what?
Like cognitive behavioral therapy, which is a way of teaching people to rethink what they're doing. And then for certain people, something called dialectical behavioral therapy, DBT.
What is that?
Well, you really learn how to how to deal with your own self in that process. So what gets you mad, you try to understand better. What gets you scared, you try to understand it better, and you develop techniques in the process. It's both in the DBT to just take a look at things differently, and tricks that you can use to calm yourself down if you need to, or to...
Could you tell us one?
I'm not an expert in this. There are people who are experts in this.
I want to get instant help.
Well, sometimes when you're feeling very anxious, you could start, one of the things they teach, I know, is to start looking at every single object in the room. Just look at them.
Okay.
So you look at the light switch, you look what color it is, you pay attention to, get it out of your mind, like. And that's one little technique they have.
So you're getting your mind off your anxiety or whatever by looking at diverting it.
Diverting it, doing deep breathing techniques, which actually do work.
Tell us that.
Well, if you breathe into a count of about, let's see, any number is fine, but let's say to 4.
Yeah.
Deep breath. It's a little bit Buddhist-like, you know, that kind of the yoga kind of thing. And then you hold it for about 4, a count of 4, and then let it out very slowly for a count of 8. And you do that a number of times, your body just gets really comfortable.
Okay, say that again, would you mind?
4 minutes,
Okay.
not 4 minutes, a count of 4,
Okay.
let's say 4 seconds.
So you breathe in.
Real deeply.
Yeah.
And then you hold it for about 4, and you go. You do that repeatedly, and it really calms your body down.
See, I'd love to have my fabulous guests like you, give us some little tips.
Yeah,
and you
sure.
just did. Thank you.
These are just some of the things. There's a lot of techniques involved, and I'm not expert in those, like some people who do that full time.
Yeah. So psychiatry has changed. My father was a Freudian psychoanalyst, and if I tell psychiatrists that, they kind of look away, they get a little upset
Freud was
with me.
brilliant. Freud was brilliant, and the techniques that he developed and people after him developed were fine, but they didn't help the really, really, really sick, the severe depressions. And they took a long time to work, even if it was just, growing up and becoming an adult and behavior-wise. So, and as a result, the really sick got put away in the institutions, in the bedlams of the world. Now, Bedlam was back at the turn of the century or something like that.
Yes.
And gradually, they would just stay there all their lives because we didn't have the capabilities of treating that. Now, we are way ahead of the game. It's like watching, it's almost like watching when we first started to do open heart cardiac surgery, the changes that occur, like when we first discovered antibiotics and started using them. So these kinds of things have saved many, many lives, and I think this is saving a tremendous number of lives and making lives normal for people who otherwise would have been locked up someplace.
Yeah, no, it's wonderful in many ways. Will you come back, because we have so much more to talk about?
Anytime you'd like, Suzanne.
Would you?
Yes,
Really?
absolutely.
And we can talk about, so one of my crew mentioned, could we ask Dr. Fischman about the suicides? The kids are putting themselves on the railroad track. We'll talk about that sort of thing next time.
Well, there are a lot of factors involved. I think one of the big factors here is the high level of competition that goes on in the schools, and the families that we have here and the schools that we have here all are all after turning out the very best they possibly can. And they want the very best. And some people at times of life, particularly as teens, when there's so much pressure to get into colleges and you're not good enough if you don't get into the large colleges, which I totally don't agree with, I must say.
Yeah.
But the famous colleges,
yes.
Even Stanford it's a fine school, but there are other ways of doing good things in the world. And if you look around, you'll see the Steve Jobs of the world, and they dropped out of college, and they went on and did it their way. Now, those are extraordinary people, but still, I think it gives you a sense that you don't have to go to the top of the schools.
See, you have so many important things to say. We'll have you back in 6 months.
Wonderful. I come back anytime you'd like.
Okay. Thank you so much. You've been...
It's great.
I knew that. I wouldn't have chosen you. Mm-hmm. I had to brag a little bit about the wonderful guests like you that I have.
Thank you.
Anyway, I want to thank our crew. Don't we have a darling crew?
They're so much fun to be around, I'll tell you.
I know. And of course, I want to thank our audience for watching. What would we do without you? This is what I always say, and it's really from the heart. It's when I can really be dramatic. And, wait till you hear. I can't wait to see you next time. Bye-bye.